Hello everyone. I am Dr. Vibin KV. I am a consultant pediatrician and pediatric intensivist at BLK Max Super Speciality Hospital. I also run the pediatric clinic at Dios Hospital, Safdarjung Enclave. Today in this video, I am going to talk about the unwanted usage of antibiotics that is so much prevalent in our society. So one needs to understand that in children, most of the infections that we counter nowadays is viral infections. And the viral infections normally take a course of very high grade fever which can mount up to 103, 104 in the initial 48 to 72 hours. Subsequently, the fever intensity comes down, and usually by the end of 5 to 7 days, the viral infections start getting better. Sometimes it might just drag on to 7 to 10 days. However, we have to be very clear that viral infections are treated by just symptomatic medicines like paracetamol, some medicines for cough, cold, etc. Antibiotics are of no use to treat these viral infections. Most of the time, we end up parents taking these antibiotics because they are easily available over the counter from the chemist shop. As anxious parents, most of the time the parents want to get the child to get better as soon as possible. So they think that taking antibiotics can get the child better sooner, which is not the case. So antibiotics are mainly to treat bacterial infections, and it is mandatory that antibiotics should be prescribed if there is any strong clinical evidence of bacterial infection, not viral infections, bacterial infections, or if we have any blood tests or culture reports that are suggestive of a bacterial infections. If any of these are not there, there is no indication to start antibiotics in your child. Sometimes the doctors, your family pediatrician, might find some clinical signs which are suggestive of bacterial infections and need to be treated with antibiotics. So in such case, it's wiser to always follow the recommendation or prescription of your family pediatrician and not to use antibiotics unnecessarily. So unnecessary use of antibiotics can lead to a lot of resistance of antibiotics in your child. So in future, if your child ends up getting an infection which needs to be treated with this particular antibiotic, he or she might not respond to it. So let's keep our child healthy. Let's keep our child away from the resistance of these antibiotics. So always go by the prescription of the doctor and discuss with your doctor. If any of your doctor starts an antibiotic, what is the reason for him or her to start antibiotic for your child? And as a parent, it's your right to know why an antibiotic is started in your child. So let's be aware and keep our child safe. Thank you.